Josh, you mentioned that your practice has really grown both prior to the pandemic and especially because of the pandemic, and you use, and I know from your background, you spend a lot of time in technology. Can you tell me a little bit about how technology impacts your practice today? And maybe importantly for our listeners, where you think the future of technology is in terms of mental health and how we address it in this country?
Yeah, we have seen a significant overuse of technology in the last 9 months for people who, as you know, Jim, really was never using technology in their clinical practice, from something as basic as documenting their session notes, which many therapists around the country have been doing with paper and pencil even until the last few years, to more therapy practices relying on EMRs or EHRs, basically patient portals. And so our practice has been doing telehealth or virtual sessions prior to the pandemic. We were prepared for this, fortunately. Most practices were not. We've been using a digital or electronic medical record system or electronic healthcare record system prior to the pandemic. Many practices had not. And as you know a little bit about my practice and my work in the history, I've done all sorts of interesting and cool virtual reality and augmented reality research interventions and technological projects. And we still use those a little bit. But I think, like your organization, the most common and likely use of technology long term, really coming from the boom during the pandemic, is assessment instruments, documenting EMR, sharing of digital records with different practices, really sort of the maintenance and sharing of digital content of clinical record, which again, InView is what InView pioneers. I see practices down the road really using technology for securing and sharing of information, both with other providers, but also with their clients and their patients. And that's something that our practice has been doing for a few years. We're a little bit ahead of the game, thank goodness. But I see many more practices who traditionally maybe wouldn't have used technology this way to be using technology for direct interaction with their clients and patients, whether it's in the home. We do exposure therapy, which we'll talk about, in people's homes. I get to see people in their real world and help them in their real world in real time. Prior to the pandemic, most people never even thought about that. So I don't think we have to get too involved in the complex, sophisticated technologies, which I could spend all day talking about. But everyday technology like assessment tools that you guys use, to electronic medical record systems, to even teletherapy, that's not going to disappear when this pandemic surge is gone. It's allowed clinicians to really be more flexible and available for the people that they serve. And that's going to be a mainstay for many years.